Smoking kills. I'm damn sure everyone has heard this line. Apart from this, you have even seen it quite often on the tobacco products. The government authorities had taken this initiative to print this on almost all the tobacco products. But guys, do we follow this? Let me ask you a simple question. Are you a smoker? If you are, then you are at a greater risk for COVID-19. We all know that smoking is injurious to our health and very bad for our lungs and our body. But does it increase the person's risk when it comes to COVID-19? So guys, what is the connection between smoking and the novel coronavirus? Let's get to know that. Hey guys, welcome back to my channel Dr. Shivam's Academy. If you're walking into this little space for the first time, then I am Dr. Shivam and I make videos on everything. In my previous video on the series of coronavirus, we have already discussed various topics such as what is coronavirus, how is this second wave different from the first wave of coronavirus, and also what are the newer symptoms that you see in the patients during this second wave of coronavirus. If you haven't watched those videos, then make sure you go and watch all those videos, as well as share this video with all your family members and friends so that they get to know about this second wave of coronavirus. I'll put the link to all my videos in the description box so that it becomes quite easier for you to get in touch with all the videos. So guys, before I begin the video, if you haven't subscribed my channel Dr. Shivam's Academy, then make sure you go and subscribe the channel. Also hit the bell icon so that you get all the notifications for my upcoming videos. Today's topic is very important, guys. What is the effect of smoking on this novel coronavirus? One word answer. Bad. It is very bad. I'll tell you why. COVID-19 patients, whoever is positive for coronavirus, the main reason why they are positive for coronavirus is their body immunity is too low, as smoking is a very important factor to reduce your immunity. So guys, if you smoke, then your immunity is too low and you get the disease too fast. While smoking, you are burning your lungs. The smoke enters your lungs and damages it. Moreover, the major symptom that any COVID-19 patient who is tested positive for coronavirus gets is breathing difficulty. So, if at all you are a smoker and you get coronavirus positive, then you will be affected 100 times worse than any normal person. Smoking is a type of immunocompromised agent. So, if you smoke, then it is obvious that you have a reduced immunity. To know how the smoking affects your body when you are tested positive for coronavirus, then watch the video till the end and get all your doubts cleared. The COVID-19 pandemic has got renewed focus on the public health issues like smoking, vaping and substance issue. In recent years, the ratio of teenagers engaging in smoking has increased exponentially. It is estimated that there is a rise in 80% of teenagers getting engaged in smoking in just 1 year. This COVID-19 viral strain directly has an impact on your lungs. It reduces its capacity and limits the intake of oxygen, which may lead to ARDS as well as pneumonia. I have seen many youngsters being hospitalized with severe COVID-19 infection due to already impaired lung infection. One of the biggest damage that smoking does in an active smoker is that it destroys the cilia, which is a hair-like structure in the lungs as well as in the nasopharynx. These cilia are tiny hair-like follicles that help to trap the dead virus and debris. Also, it helps to move this debris upward out of the lungs. So, this cilia doesn't let the debris to stay inside the lungs and cause any issues. Henceforth, it can be considered as one of the main defense systems against these infections. Without that, I think these smokers are unfortunately a little bit defenseless, and this explains it very clearly why smokers are more likely to get respiratory infections and illness such as influenza, pneumonia. They also develop prolonged coughing which stays for more than a week or even for a month. Somebody who has a healthy lung may bounce back more rapidly. So if you are a smoker, then you are more vulnerable to get this novel coronavirus because of two main reasons. Firstly, as I've already mentioned, that these smokers may have lung diseases or reduced lung capacity, which increases the risk of being tested COVID positive or being infected from coronavirus and its severity. Secondly, the act of smoking means that the fingers are touching your lips. They are in contact with your lips and face, which increases the possibility of viral transmission from hand to mouth. For non-smokers, second-hand smoke is something that you need to be aware of. See, you might not be a direct smoker or an active smoker, but a person standing next to you or your friend, if he is smoking and is exhaling the smoke and indirectly you're inhaling that smoke, then you become a second-hand smoker. Currently, the main transmission route of coronavirus is through respiratory droplets and close contact with the patient. Therefore, the smoke of cigarette doesn't transmit the virus. But being able to breathe that smoke, which means that you are pretty close to that smoker, and that increases your risk at a greater level. Given that being exposed to second-hand smoke, you are at an increased risk of lower respiratory infection, asthma, and other health conditions. This weakens your immune system of your body as well as limits the body's natural defense against these viruses. For smokers, here is something that I want to tell you that you can follow and protect yourself from being affected badly from coronavirus. Many health organizations, including the World Health Organization, the WHO, suggest these smokers to quit smoking at least during this special period in order to reduce their risk of being affected from COVID-19. So now might be the best time for you to rethink about your smoking habits. So it is very essential to do all we can to strengthen ourselves and our community to improve the chances of survival if at all you are in contact with the virus. So we need to strengthen our resolve of battling this pandemic, and adopting a healthier lifestyle could be that edge we need to win the fight against COVID-19. Guys, there is a saying, no better time to quit smoking than today. So guys, just do it. Try to quit smoking and this will be very helpful to you. Coming to how fast your lungs will recover if you quit smoking. If you quit smoking, your immunity will boost up. Yes guys, that's a fact. Imagine you quit smoking today. So within 24 hours, your lungs will start to heal. And within a span of 1 month, you will realize the improvement that your lungs have undergone. You will be able to breathe properly. So guys, please don't smoke. Just think about your family. Imagine if you are smoking and you are infected from COVID-19, then you will certainly infect your family as well. All you have to do is boost your immunity. At least not by smoking. That's it for smoking. I'll make a separate video on what is the connection between drinking alcohol and coronavirus in my next video in the series on coronavirus. Stay tuned with my channel and I hope that this video was quite informative to you. So guys, please share this video with all your friends as well as your family members and educate them with the ill effects of smoking and help them to quit smoking. Please do watch all the videos in this series on coronavirus. If you didn't find the video, then I'll put the link in the description box. If you liked my video, then do click on the like button, and guys, your doubts are welcome in my comment section. I will personally answer to each and every doubt of yours. Lastly, if you haven't subscribed my channel Dr. Shivam's Academy, then just go and subscribe the channel. Also hit the bell button so that you get notifications to all my videos. Till then, take care guys. Take care of yourself and your family members. Stay safe. Protect yourself from coronavirus. I'll catch you later in the next video. I hope it helps. Thank you.